Welcome everybody to our final show for this month of Call the Doctor. Today I have a very, very special guest. When I applied to institutions in North Carolina looking to leave Pennsylvania for a job, I was most impressed by the people who interviewed me at Carolina Regional Orthopedics. And I interviewed with this gentleman over here to my left who ended up hiring me before I became a full partner in the firm. And this is Dr. Robert Martin. He's an extremely accomplished sports medicine doctor, one of the founding members of Carolina Regional Orthopedics a long time ago. And we look to him for advice and counseling and have done so for years and will do so for many more years. Mm-hmm. He's an institution in this town. He's an institution in orthopedic surgery. And so tonight's topic is going to be on sports medicine, what's new in sports medicine, trends in sports medicine, also with a twist of rehabilitative treatments, particularly regenerative medicine, stem cells and things like that. And so we're going to start talking about sports medicine topics, but we're going to add a flair with every topic, particularly about what we call biologics, or cells that we can harvest from a test tube, from a cadaver, or from our own bodies that can help stimulate our own injured tissues heal more rapidly and more completely. So Dr. Martin, start telling us a little bit what the definition of sports medicine is.
Good evening. So sports medicine is basically a discipline of orthopedic surgery where we treat injuries predominantly generated by sports, but it's not absolutely specific to that. So I think we all like to think of ourselves as athletes. So if we're trying to be active, we're trying to do something to stay fit, and we do something like hurt our knee or our ankle or our shoulder, that falls under the guise of sports medicine. Of course, our focus is to try and get you back doing what you were doing before as quickly as possible.
So a 39-year-old guy like me who's working out at the wonderful B&G gym in Tarboro, if I hurt myself, I can consider myself having a sports medicine injury.
Absolutely.
Right.
We're treating most injuries of the musculoskeletal system. We kind of divide spine injuries into a separate category, and we usually allow our spine colleagues to handle those. But pretty much everything else, hip, knee, shoulder, ankle, wrist, elbow, although those particular areas, sometimes we defer to our experts in the area of hand surgery to manage.
So largely for the audience's purposes, you don't have to be an eclectic athlete to suffer a sports injury, nor should you not ignore a sports medicine specialty trained orthopedist if you have a ligament injury and you just sustained it by tripping and falling. That area subspecialty lends itself to a certain level of expertise that may augment your healing capability significantly because they're empowered with techniques that a general orthopedist may not have. And we're going to touch on some of those as we talk about different body parts for the next hour.
Yes.
I want to ask a quick question. Can it just be something that happens as one gets older because of wearing out joints as opposed to necessarily sports related or exercise related?
Good question.
Short answer, yes. I think the way to think about it, in sports medicine, our focus is to try to get you as restored back to the condition that you want to be in. Mm-hmm. That's not always possible, but that is our focus and our goal for you, to get you back being vigorous and active in life at the highest level possible.
And pain is least amount of pain possible too.
Absolutely.
Yeah, I think I hear people talk about my knees hurt, my shoulder hurts and whatnot, and I think a lot of people maybe should have come to you sooner, but when the pain gets acute, that's when they just can't stand it anymore, and that's when, but is it important to come early on? Is there more damage by waiting to get something fixed?
as a general rule, yes. We always would like to see people earlier than later because that gives us probably a greater opportunity to engage that problem sooner, and if we engage that problem sooner, the outcome generally is better. So I think the biggest impediment, the two main impediments that keep people from coming to see someone like myself or like Dr. Perlmutter is, one, anxiety over going to see a doctor, a little bit of fear of the unknown, what might happen, what might not happen, and then realistically in today's world, cost. So those are usually the two things that people put in the formula when they're thinking about coming to be seen. And in most people's mind, those aren't good things. So they think, I'm putting this off. And at some point, their discomfort and disability reaches a point where they can't go to work anymore, they can't function in life or sleep, function in life the way they want to, and now they realize they have to come in. And so, many times it would have probably been better if we'd have been able to engage that issue sooner, but people are people. So, we do our best starting from where we start.
And we're so lucky to have such skilled physicians here in town. I mean, we really, I think a lot of us take for granted that if we get to that point where we want to seek help, we really have extremely high caliber medical staff here.
We absolutely do. And to accentuate a point that Dr. Martin was saying is, don't take away our ability to treat you non-surgically. If you delay your presentation to us, often you give us a much more limited treatment menu that we can offer to you. So, and the earlier that you give us a problem, the more likely that we can get you better without a surgical procedure.
Do we want to give a telephone number? You want to mention the telephone number?
Absolutely. It should be showing up on the screen intermittently. The number that's showing up now is what to call in if you have a question for Dr. Martin or I. But the number of our office is showing up now is 443-0400, and all members of our team are available for consultations at any time.
And you will take calls if people want to call in during the
Absolutely.
show.
You can call now and we'll field your questions. Until we get a call, I'd like to talk about some body parts.
Sure.
One of the most common body parts that's injured in an athletic injury is the shoulder. And people understand the term rotator cuff tear. Not everybody understands what that is. It's probably one of the most common injuries, both with athletes and with non-athletes, in the shoulder. Why don't you take a moment and explain to us what a rotator cuff is and how it's repaired, how it's treated non-surgically, and then we'll talk about other parts of the shoulder.
Sure. So, simply put, the rotator cuff is a tendon that connects the muscles from your upper back to your shoulder. So, there are two groups of muscles that run the shoulder: the rotator cuff muscles, of which there are 4, and then this kind of muscle we think about, this meaty muscle on the outside of our shoulder, which is our deltoid, and those two muscle groups run our shoulder. So the rotator cuff tendon is the tendon which connects the muscles of the rotator cuff to the upper part of your arm, and it's called a cuff because it starts kind of in the 4 o'clock area and then it goes all the way around to about the 7 o'clock point. And up at the top, between 10 o'clock and 2 o'clock, is where the rotator cuff commonly gets stressed and will at times tear. So there can be tears that occur suddenly, which is less common. The tears that occur gradually over time, sort of the way the knee of your pants wear out. You wear them long enough, and then one day you walk in the house and your spouse says, how'd you tear your pants? And you look down at your pants and you realize, oh shucks, they're torn. But when you take those pants off and you feel that fabric, you realize that fabric had got kind of thin, and then you just did the wrong thing at the right time, and now it's torn. And just like your pants, If you want to save those pants, you take them off right away and you take them to the seamstress or a tailor and you have them repaired. If you keep wearing those pants, that tear is going to get bigger. So that's why it's important to allow us to engage this problem early, because if that is what's going on, there are things that we can do to treat it without the problem getting so significant.
And without surgery.
And sometimes without surgery.
Right. So let's say you have a hole in your pants. What are the options, Dr. Seamstress, that you have to repair that hole in a knee?
And is that an example? Is that a shoulder?
This is, in fact, a shoulder. So these are the rotator cuff muscles. This is the supraspinatus muscle at the top.
Maybe we can zoom in on this too.
And then infraspinatus teres minor. And then there's one that is on this side that is not shown, that's on this flat underside of your shoulder blade, which is the fourth muscle. And all of these are coming this way and come around and connect to this bone right here. And that is why it's called a cuff, because it goes around from front to back.
Are the
So-
green things the tendons?
The red.
Oh, the red.
These are tendons.
So just to clarify, if I can do this backwards, with the screens backwards for us, this is the ball and socket joint. This is the top of the upper arm here called the humerus bone, and this is this shoulder blade. So you're looking as if the torso was removed, your body was removed, and this is the front of your shoulder blade. So the back of the body is aiming towards me. I'm looking at the back of this body. And so there's a muscle on the underside which comes around and wraps like this, and as it shortens like this, it takes this ball and socket joint and rotates it. The muscles that come from up top and attach here, as they shorten, it brings the arm in an up and outward direction. And then there's muscles on the back of the shoulder blade that wrap around this way, and as they rotate like in this direction, it'll take the arm and rotate it outwards like my arm is doing here in this direction. So there's simple little pulley systems that, by way they're attached to the scapula and come from the scapula and attach to the humerus bone, they can rotate the shoulder in multiple directions. And when you blend those directions, you can put your arm in any position. And where they come together to cap over the shoulder, that's the rotator cuff. Fair enough explanation?
Absolutely.
So the most common areas of torn, I think you told us, were in this area right up here.
10 o'clock to 2 o'clock, yes.
Right. So pretty much if I hold it from the side, right underneath of my fingers. And if it tears, the tendon retracts back and you lose the ability to rotate your shoulder.
Is there a lot of pain associated with it?
Typically, yes. Most people know they've done something because as Dr. Perlow is showing, the shoulder joint, the cup is very shallow. The cup is really only about as shallow as the palm of your hand. And so the ball is balanced there. And these four muscles that contribute to the rotator cuff are pulling in a balanced manner, balancing the ball in the cup. When one of those is not pulling in the same manner, the ball stops being balanced. And then that affects the function of the shoulder. So it's like you had four horses pulling a cart. If the horses are equally strong, the cart goes straight. If one horse is lame, then the cart's not going to pull equally up the road. So once that balance is off, people develop alternative mechanisms to try and move their arm the way they want. Because really the shoulder's function is to place your hand where it needs to be in space to do what you want it to do. Mm-hmm. So when it can't do that, it tries to recruit other muscles and other things to help do that, and that completely affects the balance and changes it stresses other muscle groups, and that's why many times people come in and their neck hurts and their upper back hurts, and those we call those compensative mechanisms.
We've got a call. Sandra, you, not yet, okay.
So when somebody, let's take it back to a true sports injury. We're looking at somebody on the Wesleyan football field or in Rocky Mount or Tarboro, and we take care of a lot of their injured athletes. And what would happen if they fall down on an outstretched arm and their shoulder dislocates versus the phrase separates, a shoulder separation versus a dislocation? Help us understand the difference between those two and what we would do about it.
Got it. So, two different joints. When we speak of shoulder dislocation, we are talking about the ball and the socket joint. So again, this joint here and the socket here. So because the joint is so the cup is so shallow, the ball will, if enough force is applied, pop out of place. It most commonly pops out to the front, and when that happens, it sometimes requires a trip to the emergency room or a healthcare provider that's immediately on the scene to reduce it. The separation injury is between your collarbone and this bone right here. So the collarbone's not in this. Your collarbone would be sitting about like this. So that is between your acromioclavicular joint. So the clavicle is commonly termed the collarbone. So that is this joint, whereas the dislocation is this joint. So we hear about the separation injury a lot in football because when you kind of fall on the point of your shoulder, you will damage the ligaments in that joint, and that's a common injury in football. But that is not most of the time a injury that requires an operation. Many times we can treat that non-surgically with just rest and ice and time off. But when we have a dislocated shoulder, that is a little more serious and can many times require an operation to stabilize, repair the ligaments in the front of the shoulder to keep the shoulder from continuing to pop out of place.
So to summarize then, if the ball and socket joint separates, ball usually pops out of the front.
That's the dislocation.
Right. And we can often put that in without surgery. However,
correct.
When you pop the ball out of the socket and it stays in an outward position for a while, or just a trip outside of its normal location, that can tear ligaments that normally have the job to hold that tightly in place. If those ligaments are substantially torn, you may need a surgical reconstruction, particularly if you're a young athlete. Most older people actually get by pretty well without a surgical reconstruction there, unless they tear the rotator cuff from that trauma.
Correct.
And it doesn't heal. So if it doesn't heal, say they come to you very late in the
So to
game.
clarify that point, if you're under 20 and you dislocate your shoulder, your probability of that shoulder popping out again is pretty significant. If you're over 40 and you pop your shoulder out of place, you dislocate your shoulder, your probability that that shoulder is going to come back out of place is relatively small. And just as Dr. Perlmutter mentioned, the more common injury is you have injured your rotator cuff. As opposed to when you are a younger person, the more common injury is you damage the ligaments that stabilize your shoulder. So two different scenarios. We will try our best to manage these injuries without an operation, but if there is clear evidence that damage has occurred that will not heal itself, then you are best served with an operation. The good news is almost the vast majority of everything we do in the shoulder can now be done arthroscopically. And by that I mean using a camera through small incisions, do all the work on the inside. So outwardly minimal incisions. We do the operation on the inside. You come in, go home same day. And quicker recovery, less discomfort for you for the procedure. As an example, rotator cuff surgery is almost exclusively done in today's world arthroscopically. There are very rare occasions when we would consider a larger incision to repair the rotator cuff. I'll mention briefly that there's a new procedure where if you've torn your rotator cuff and it's torn to the point where we cannot fix it, there is, in the last 6 years, become a great alternative that would allow us to put a graft, a soft tissue graft, in that area and take the place of that upper rotator cuff tendon, and it keeps the ball centered and helps preserve the joint so you don't develop arthritis. So that was not available before about 6 years ago, and what would happen is you would go on to develop severe arthritis and you would require some form of joint replacement surgery. So that is a real advance in the area of shoulder surgery to allow us to preserve shoulders so we don't have to necessarily replace them.
And that's
Take a break. We need to take a break.
okay. We'll take a
Okay.
break, and we'll be back after this message, and we'll see you in a few minutes. So I'll
You again. You do not have time to wait in line and pay to put air in the tires, and you certainly don't want to get out of the car in the cold and pump gas. What if you could pull up to a gas pump and have an attendant run out to greet you to pump your gas, clean your windshield, and put air in the tire, all for no extra charge, while you step inside and enjoy a made-to-order breakfast or lunch? Does that kind of full service exist anymore? It does, at JD's Grocery & Grill, a service station created to bring back the full service experience to all customers. JD's Grocery & Grill is a full service gas station. Eat in restaurant with tasty made-to-order food and a grocery store all in one. The staff at JD's Grocery & Grill is ready to field all requests and will help you find anything you need. Call them today at 252-972-5000 or stop on by at 1240 Atlantic Avenue. Store hours, Monday through Saturday, 6 a.m. to 6 p.m. Grill hours, Monday through Saturday, 6 a.m. to 2 p.m. JD's Grill & Grocery, at the heart of great food.
I want to be clear in how I characterize this. This is mostly a protest. It is not, generally speaking, unruly.
I'm Robert Crescione. I'm back with America in Danger because now more than ever, our country is threatened by things that affect the very root of our nation. We'll be talking about those things on America in Danger in the weeks to come. Join us each week for America in Danger, 6:30 Saturdays on WHIG TV, because these issues matter to you.
Buying a Toyota should be as fun as driving one. This is Trey Turner from Rocky Mountain Toyota, where we've made the car buying process simple. Get straightforward pricing on all your favorite Toyota models, so you can skip the hassle and the haggle and get back on the road in no time at all. Plus, enjoy the peace of mind that comes with our complimentary lifetime warranty, unlimited time, unlimited miles. Come see me today at Rocky Mountain Toyota or shop online at RockyMountToyota.com.
Welcome back, everybody. I want to just refresh the last comment that Dr. Martin said about using a graft, and use that as a segue to talk about the other major part of tonight's talk, and that's regenerative medicine, the use of stem cells to help augment tissue healing. And that means you heal faster and you heal more completely when we include stem cell products in healing. So he had mentioned that if the rotator cuff had a complete tear in it, and the olden days, 6 years ago, there's not much we can do to repair that other than really advance you towards an artificial shoulder, because we need tissue to plug holes. So if you had a big tear, and I ripped off a piece of paper here to show you what a graft would look like, and the rotator cuff was not repairable in this area here, we can take that graft and sew it into your natural tissues, and then use that graft to essentially plug the hole. And then over time, that graft, which is typically harvested from a donor, somebody who gave their heart and their lungs and their kidneys to help other people in distress in medicine, we take other tissues from them, process them, so the chances of a tissue reaction are way lower, and we'll sew this into your shoulder, or in this case, your Achilles tendon in your ankle, or your ligaments in your tendons in your knee, and we can use this tissue to augment our repair and increase your healing capability just tremendously. And so this is part of what we're talking about by biologics. And so let's use that topic as a segue when we use grafts to talk about and define for us, because you've really been at the forefront of this, more so than just anybody in North Carolina. Define for us really what regenerative medicine is a field. And of course, it got its start really in sports medicine, but it applies across the field in orthopedics now. I rarely do the surgery where I don't use stem cells as part of my surgical repair. And it's just such a valuable part to augment the quality of somebody's outcome. But teach us a little bit what regenerative medicine is in general, Dr. Martin, and then we'll get into some specifics.
Got it. So regenerative medicine is trying to use your cells, the cells that are in your body that have a high potential for healing, concentrate those cells, and then use those cells in an area where you have disease or injury to try and speed up the healing process. So as we've learned in the last 20 years about the sophisticated nature of cell biochemistry, we've learned that on a cellular level, there are many chemicals that help stimulate cells and trigger cells to grow and develop. As we've studied these and learned about these, we are learning how to take cells and encourage those cells to essentially emit these chemicals that will then, when we concentrate or aggregate these cells together, create a powerful healing force. And that healing force is coming from your own body. So we're not taking anybody else's tissue, we're not injecting chemicals into you or drugs into you. We are literally using your cells and your own cell chemicals to stimulate a healing response in an area of your body that needs to heal. So that, in a nutshell, is regenerative medicine. There are a few different areas that we focused on, and we can jump into those if you want.
Right. So, but to add to that a little bit, let me add my thoughts on that. You can use your own cells, and often we use cells that are stem cells from somebody else. And that could, from another source at least. And some of those sources in other countries, not used in our country, are from embryos, typically from aborted fetuses. That has a lot of ethical and legal issues in the United States and is typically not used anywhere that I know of. We can use stem cells that are donated from living donors. And we can use stem cells that are from the umbilical cord of healthy babies that are born. And we use those stem cells because they still have some fetal tissue in it, but it's not from the baby, and it's not from an abortion. So it eliminates all of the ethical issues that are typically surrounding the use of cells that are derived from aborted fetuses, and that's very understandable. However, if you have a baby like my brand new granddaughter that was born, it's quite typical for people now to take the stem cells from your own umbilical cord and bank those in case my granddaughter has a health issue down the road. She has a collection, a concentrated collection of her own stem cells to use 40 or 50 or 60 years from now. They'll be kept frozen for that whole time. And that's just truly amazing. But her stem cells were also donated to be harvested and stored to be used by anybody else who needs her stem cells for a disease healing process. And we can then purify those cells, and even the parts of those cells we call exosomes that can influence healing. And so we're not really giving a cell to somebody else, we're just giving the living inside part of that cell that carries all those healing chemicals that the cells make, and we can inject those exosomes into a part of the body that needs to be healed without the use of surgery for diseases that would otherwise typically require surgery. For example, we're not talking about tennis elbow today, but I've injected exosomes into multiple patients with tennis elbow, which is where a tendon rips off the elbow, splinted them, and all have healed perfectly, including my own twin sister's bilateral elbows. And so stem cells are a very, very valuable tool that we use when they're used intelligently and applied perfectly.
If you use somebody's own stem cells, where do you get them out of a person?
So you can get stem cells from the adipose tissue, so fat. In orthopedics, probably the most common place that we obtain those stem cells is from your bone marrow, and the most readily available access point for your bone marrow is your pelvis, because it's very rich in these cells. So we call that bone marrow acquired cells, so BMAC. So BMAC, bone marrow acquired cells, we put a needle into your pelvis and aspirate some of the bone marrow, and then use a process to isolate and concentrate those cells, and then they can be prepared so they can be injected back into the person, into the desired area where there is injury or disease. This has become a treatment that's been used more commonly in knee arthritis. Many elite athletes are getting BMAC treatments for their knees. If you're a golf fan, Mr. Koepka on the golf tour, the PGA Tour has had BMAC treatments in his knee, and I think Dustin Johnson's had BMAC treatments on his knee. So the science, we haven't done enough long-term studies to know that will this make a 10-year, 15-year difference, but it certainly made a difference in the short term. And what we're trying to do, which would be different than anything else we've done before, is to try and repair cartilage that has been damaged. And there is hope that this can potentially accomplish this, or at least accomplish this on some level, because there's nothing else we have that will truly repair damaged cartilage. So this would be a huge breakthrough. There's some basic science to support this, and so, as always, you have to wait and see if this pans out when you're treating real people.
The call that we had earlier that the person didn't want to talk was concerning knee. Were you going to make a comment about that?
Sure. When the cartilage of any joint is damaged, that's irreparable prior to the use of stem cells, meaning that the damage that's done to a knee cartilage or any cartilage, and it may look like the surface, instead of a very smooth porcelain-like surface, it may look like the surface of a golf ball or the surface of the moon with chunks of cartilage missing. The healing potential on its own is literally zero. And so the choices that have been given to us, and we'll focus on a knee for this answer pursuant to the caller's question, our choices have been to provide pain medicine, encourage weight loss, which is a critical thing for knee arthritis, which we can talk about later or another time. or we can put a layer of lubricating medicines that coat the surface of the knee, and that's called Visco Supplementation. Some people in the past have called them chicken shots because we used to harvest them. We used to harvest it from rooster combs and wattles, the little thing that hangs from their neck. And because they're rich in a material called hyaluronic acid, which is a key component of the natural slipperiness in natural joint fluid. Now almost all of the modern ones are made by man in test tubes. They're very high concentrations of that slippery protein, and we can inject that in a knee. And I'm a fan of it. I inject it in most people's knees. Again, our ethos at our group is to try to keep people better as best as we can out of the operating room. And if it's a valuable, time-proven and research-proven tool, we're going to use it as long as it's okay with the patient. And there's other factors like will the insurance company pay for it and issues like that. But if it's an effective tool that can prevent surgery, fine, we'll use it. But back to stem cells, I mentioned earlier that cartilage has not been able to heal itself, but you can take some cartilage cells, send those off, get them cultured, replant them back with or without other stem cell products, and it's been shown that cartilage will regrow.
Great.
And so for very specific lesions, you might be able to change that person's course of life quite dramatically. Now, if somebody has a whole complete knee that's completely worn out, bone is grinding in the bone, that's gone too far. There's no miraculous treatment for that, and that person is probably best served by a knee replacement surgery, which has an amazingly fine outcome, particularly in super skilled hands. However, lubricating medicine has its role for moderate or more less involved arthritis, stem cells for moderate and less involved arthritis. And it reiterates the point that the sooner that you come to us, the more chances you have for those treatment modalities to be applied to you.
We have another caller that wants to ask a question.
Sure.
He has in high school he had a wrestling injury toward his cartilage. He wants to, and it still hurts today, a few years later, and he wants to know, is there anything he can do now?
Sure.
Without being cut again. He said, I don't want to be cut again.
Well, so just like we've been trying to emphasize tonight, we start with the easy things. So the first thing I have to start with is an accurate diagnosis. So if the patient chooses, the caller chooses, we can see the individual. Let's make sure we understand what's wrong, and then we can talk about the options to treat what's wrong. And the options for treating what's wrong almost always start with something non-surgical. And so what I try and emphasize to people is, I work for you. I'm going to tell you what the choices are, and you tell me what you're comfortable with, and then we're going to work from there. I am not going to try and force you to do something you don't want to do. I mean, that's never a good idea. So, but again, we must start with an accurate diagnosis. So if they're really having an issue and they want to see any of us at Carolina Regional, we can help start from the beginning and figure out what's wrong and what we can do about it.
Do you think that they heard the question, that your voice came through? Should we say this was an athlete who tore some cartilage?
You might want to reiterate, because I'm
And so you were answering the,
Oh, I'm sorry. So the question was, there was a athlete who had a sports injury wrestling in high school and was told that he tore his cartilage. He apparently, if I understand correctly, has had some surgery, is now still having pain and disability in his knee, and wants to know if there are things can be done short of another operation. So that's what we were basically trying to address. And again, my answer being, let's make sure we know what's wrong, and then let's talk about what the options are from there, and see if we can get you better with another operation.
And there are new things now that we don't know how long ago his surgery was, but I mean, I think
Sure.
it's just incredible to hear these new things that
Sure.
you're doing that, probably, 10 years ago, none of them were on the horizon even, so
Right.
that's great.
And he may have actually healed the pathology from his initial injury because of the surgery, and something else may be showing up.
Yeah.
And so Dr. Martin is right. Nothing is more important than a careful, detailed physical examination to really isolate the source of injury. Stepping back to stem cells, because that may be the choice that this fellow may need to address his injury. One of the most common things that we use is a substance that a lot of people have heard about but have a very poor understanding of. It's called platelet-rich plasma, or they hear the acronym PRP. Teach us about PRP.
So, our blood is composed of red blood cells, white blood cells, platelets, and then essentially the liquid that it's in, which we call plasma. And there are a lot of things that are in plasma, but what we're trying to do is take your blood and then, through a simple centrifuge, separate out white blood cells, red blood cells, and concentrate the platelets in the plasma. And by concentrating platelets in this little nugget of plasma, then we have, as we said earlier, these cells that have many growth factors and other advantageous chemicals that they emit that can stimulate injured or damaged cells to heal faster. And so we obtain blood just the way you would if you went to the doctor to give a sample to check your blood count. And then we take your blood and we take it to a separate place and use the centrifuge, so spinning it down, and then get that concentrated nugget of the platelets in that plasma, and then that can then be injected back into you. So it's your cells going back into you. And places where PRP has been shown to be advantageous is in the treatment of knee arthritis. So there have been studies done on PRP compared to gel and compared to cortisone, and PRP in some studies, in recent studies, have been shown to have better and longer outcomes. So less pain, less swelling, less stiffness.
And the chance of actually healing.
Well, there are no studies that show that PRP can heal arthritis. Not yet, but that would obviously be great if that does occur, but that is the holy grail, to be honest with you. If we can come up with a strategy to reverse arthritis, that will be the person that figures that out will be richer than Bill Gates and Mr. Bezos put together.
Speaking of money, do insurance companies typically pay for any of the stem cell treatments that we talked about? Are some in favor or some out of favor?
Right. So, like with all things, this is a moving target, but typically PRP has not been covered by most insurance carriers as an outpatient procedure, meaning you want PRP treatments for your knee, or as Dr. Perlmutter described, say for something like tennis elbow. There are very few that will actually pay for that. That's starting to change as PRP is being shown to be a very valuable treatment. But be prepared if you're interested in this. There may be some cost you have to bear to have this done. The good news is PRP is not extremely expensive, hundreds of dollars, not thousands of dollars. Stem cells, so the BMAC treatment we talked about, bone marrow acquired cells, most university centers in metropolitan areas that are doing this on a regular basis and have set up clinics to do this, it's like plastic surgery. It's all cash on the barrelhead. The the last time I was at a meeting and heard this discussed, I mean, I think the typical treatment is costs, soup to nuts, is about $3,000. So thousands of dollars, not hundreds of dollars. So I think with time, as these treatments become more commonly used, I think we'll find that the cost will come down, and as we prove that these are advantageous to treat arthritis, to treat some of these other conditions for which we've only had the option of surgery, I think the cost savings that you can get, as expensive it is to go to the hospital and have a big operation, if we can treat you with something that can be done in outpatient setting, then that will probably drive the change. And insurance companies will be much more interested in paying a few $1,000s versus tens of thousands of dollars
Absolutely.
for an operation.
I want to mention with PRP, a lot of people may have heard that they're really promoting it for hair growth.
Yes.
As people are balding and whatnot, you can get, that, so that just shows it's been around and is being used to really help people's, regenerate a lot of things.
It's done thousands of times a day in this country where there's a process called microneedling on the scalp. It stimulates an inflammatory reaction, and it using PRP or exosomes or other stem cell products, it drives those stimulating chemicals deep into your scalp, and hair follicles that are still there will proliferate. A lot of great documentation that it works in that scenario, which is proof that it could work almost in any scenario.
And very safe.
And if applied correctly, and very safe. It works for men and women, and that's also done even locally.
Well, keep in mind, back to the safety issue, just to reiterate, in case you didn't hear it the other 3 times we mentioned it, is that these are your cells treating you. These aren't anybody, this isn't a drug, this isn't anything other than your cells being used to treat you. So that's why, from a safety standpoint, that's one of its strengths, I believe, that because many times we use things, chemicals, drugs, other things to treat that are not native to your body. This is taking your own cells and using the chemicals that your own body emits, concentrating them and using them to help you heal.
And that's a really important point to hear, because if you read about stem cells and the application of stem cells, many people throughout the world are using stem cells from embryos or stem cells from umbilical cords, or the part of the umbilical cord that's close to the embryo as opposed to the part that's close to the mother. And the closer that you get to the baby, the greater the chances that those stem cells can cause cancer. We can lower that risk tremendously by isolating the part from those stem cells. We can actually eliminate the risk of cancer completely by not giving any cells, but using parts of the cells, the chemicals that are in those cells. Again, they're called exosomes. And increase the healing potential tremendously. And that's something that Medicare is actually paying for now. Actually, the commercial insurances are not paying for it, but the U.S. government has recognized its value, and there's a whole collection of diagnoses that they will actually pay for the purchase and the application of this stem cell derivative product, which has only been available this year. So the field is exploding, and then when the average person goes online and reads about it, because COVID has shown us that not reading skilled medical information and misinterpreting it can scare the hell out of you. It's probably one of the biggest reasons why many people aren't vaccinated yet, because they don't have a true understanding of the safety profile of the vaccine, justifiably based on what you could read on social media. But when you read about stem cells on social media, you'll read about causing cancer and things like that. That doesn't happen in the United States. The stem cell products that we're talking about are 100% safe, particularly if we use your own. But if they're harvested and we only use stem cell products from umbilical cords, they are also 100% safe. And insurance companies are beginning to pay for it. Yeah.
I want to say, you mentioned that sometimes people won't come to you because they're concerned about surgery. My husband had surgery done by you recently, and I cannot say enough nice things about Nash UNC's surgical unit. The staff there, it was just, of course, I wasn't the one having surgery, but everybody was just as good as they get, as good as you could get. I mean, I don't see how, and they were very pleased about working with you, and I'm sure Dr. Martin, you also, but I think people can really feel that we've got a top-flight surgical place here if indeed they need to have surgery.
Oh, I think so. I mean, Rob gets the, one of the few surgeons that gets the highest scores of patient satisfaction in the entire UNC system.
Congratulations. Wow.
He's extremely appreciated by his patients, and that's because we share the same work ethos about treating people like family and not pushing people to surgery. But not just in our group, the entire Nash surgical group, whether they're within our group or our partners or even our technical competitors in the orthopedic world, everybody strives to do an excellent job. You're not going to get better trauma care than anybody other than Eddie Hasty. You're not going to get better spinal care by the neurosurgery team or the spine orthopedics teams that we have. A young sports medicine guy that is phenomenal, Dr. Clay Nelson, and those are people that are not part of our actual team, but are there. The new general surgery team that's there is phenomenal. The anesthesia team is second to none anywhere in the world. And so kudos to Lee Isley for putting together, and his team for putting together a wonderful management team that stimulates the health of the medical team, so that we can continue to offer excellence.
Yeah.
It's really an administrative-driven thing.
So I think, to your point, the thing that makes the patient experience a good one is getting back to what I said, I think earlier, most people, the biggest thing is that anxiety, that fear of the unknown. And if you have a group of people that are happy and friendly and create a relaxing environment for you, it reduces that in your experience. I mean, if you weren't a little nervous, you wouldn't be normal. I mean, it makes me a little nervous when people aren't a little nervous, but as a general rule, if you can make that, ease that anxiety, and I think that's the goal of the staff. I think the nurses in pre-op, the nurses in post-op, everybody, nurses in the OR, the anesthesia staff, our goal is to try and make you as comfortable and relaxed as you can be going into surgery, because we also know that if we can relax you going into surgery, you tolerate the operation better, you tolerate anesthesia better, you come out of the operation more relaxed and less stressed. And so I think our staff does a fantastic job doing
Oh, yeah. And PT, because he's had to go to physical therapy. And
Amazing.
They absolutely know, you all give the best instructions to the physical therapists, because they know, oh yeah, this is what Dr. Perlmutter likes, and this is what Dr. Martin likes.
And they cater to our individual needs. And and Nash has a wonderful therapy team. Our office has an unrelated but wonderful therapist. And there's fine therapists all through our community. Vida Edgecombe has amazing therapy department as well. Manual physical therapy in town is phenomenal. We are just surrounded. You can't make a bad therapy choice in our community. You really can't.
Great to know.
We only have a few minutes, and I want to take some time to talk about COVID with everybody. Last Wednesday, we had 14 people in our hospital's ICU. Now we have 34.
In the hospital, not the ICU.
In the hospital.
The hospital.
Yeah, I meant to say hospital. I apologize.
But COVID.
And I don't know this for a fact for our hospital, but if it matches national trends, probably 100% have not been vaccinated. So I would encourage those who don't want the vaccine to talk to their doctor. Stay away from social media advice. It's total baloney in all probability. Wear your mask when you're in public if you're not vaccinated, because you're really caring about the person next to you. You may have it in your mind that you're right not to wear a mask, but if you infect the person next to you, perhaps even someone you love, you could be responsible for their death. And so you have to take this more responsibly. Throughout our country, we have a greater percentage number of children in ICUs. There's pregnant mothers in ICUs in the South right now, and young people. The average age of the person admitted to the ICU is at least 10 years younger than it was 6 months ago. The Delta variant is more like an alpha timber wolf compared to a newborn poodle, the old virus. It's infinitely more aggressive, so please respect that. Strongly consider getting vaccinated. It is the right thing to do. We'll be back in 2 weeks with Call the Doctor, and thank you, Dr. Martin.
Thank you.
Thanks for having me.
Sharing your wonderful expertise with us again. Have a blessed night, everybody.
I have something to share with you.